is Tahir Ali. I am going to be the Zoom moderator for this program. This program is going to be recorded and then later on put on YouTube for further viewership. So before we start the program, I'd like to introduce Dr. Yusuf Sheikh, who's the president. Dr. Sheikh, can you take over from here?
Sure. Yeah. Thank you, Tarsab. I appreciate it. Assalamu alaikum. So, welcome everyone to our fourth webinar. This is the fourth webinar in a series of webinars we've been doing since January, February of this year. And the topic of today's webinar is extremely important because it affects 100% of the people. Whoever sleeps is affected by either lack of sleep or different in the quality of sleep. So, and as you can imagine, we spend 1/3 part of our life in sleep. And the sleep requirements are different when we are young, it's different when we are adult, and then different when we are older. And some people may not realize how proper sleep is required for our proper health and well-being. So with this one, I'd like to thank our panelists who took time from their busy schedule, and they're coming online with us to share their knowledge and expertise with us. And I also appreciate Kaisar Khan, who's our member of the board and a dear colleague at UMass, who's will be the moderating the event. So Kaisar, please take it from here.
Assalamu alaikum. Thank you, Tahir Saab and Yusuf for the introduction. So today we have two great speakers who will be doing their presentation. The presentation is gonna be around 30-40 minutes. The whole session is like 1 hour, and most of the questions will be answered at the end of the presentation. And any questions if someone have, they can always type it and they will be addressed after the presentation has been completed. The two speakers that we have, first will be Dr. Khurshid. He is an associate professor of psychiatry and director of Center of Neuromodulation at UMass Medical Center. He is a sleep consultant to UMass Lung and Allergy PC. He is trained in internal medicine and psychiatry at Southern Illinois University and completed a sleep medicine fellowship at University of Chicago. He has been involved with American Association of Sleep Medicine and has chaired national committee related to sleep medicine. He provides consultation to persons who may be suffering from various sleep disorder. He also consults with organizations about sleep and how to incorporate sleep in health promotion and well-being. The second speaker is Dr. Batul Anwar. She is assistant professor in medicine and associate director of sleep medicine fellowship at Brigham and Women Hospital. She is board certified in internal medicine, pulmonary medicine, and sleep medicine, and has been involved in both clinical and research in these specialties. She has authored original reports investigating epidemiology and quality of life affected by sleep disorder. She has mentored residents and fellows in sleep clinic and also in ICUs. Her area of interest are sleep disorders on quality of life, impact of COVID-19 on quality of sleep, and palliative care among critically ill patients. So with that, I will hand it over to Dr. Khurshid to start our series of webinars as a part of APPNE that we continue to do for our community. So over to you, Dr. Khurshid.
Thank you for inviting us. Pleased to be here. In addition to my academic credentials, I've had my own struggles in pursuit of a good night's sleep. This is an outline, a little bit about normal sleep, sleep disorders. I'm going to talk about relationship between sleep and psychiatric disorders, give you some tips how to improve sleep. Sleep is a state of detachment from surroundings, near complete detachment, but selective. A mother can be easily woken up by a baby's cry compared to a louder noise. Sleep is a complex, biologically regulated state. It is not just a passive state. Sleep is important for health and well-being. It has a preventive role in preventing medical and psychiatric problems and promoting good health. Sleep is a biological need. We need food, we need water, we need sleep, just that simple. Sleep is a circadian rhythm. We have various rhythms in our body in relationship to day-night cycle. Sleep is one of those rhythms, is a circadian rhythm, and it is related to other circadian rhythms. Whether you are working hard, driving on the potholes of Massachusetts or in the rice fields of Kashmir, get tired, come night, sleep restores you, you're ready for the next day. Sleep is important for health, is important for learning. Sleep is important for learning, not only for children, for adults also. For those of you who are clinicians, it has been shown that sleep improves learning. It helps with procedural learning. It's not just an additive effect, it multiplies. Sleep is important for immune function. It prevents us against infections. We recover faster with good sleep. Sleep also boosts the effects of vaccination. Sleep is important for emotion regulation and well-being. Our responses, emotional reactivity is more appropriate and more measured with good night's sleep. Now, when we talk about sleep, we talk about sleep stages. Two things you would hear about is non-rapid eye movement sleep and rapid eye movement sleep. This REM sleep or REM sleep, also called dream sleep. We characterize these sleep stages by recording brain waves, eye movements, and muscle activity. And you might hear about slow wave sleep. These brain waves are slower. Now, in a typical night, we go through about 5 cycles of sleep, starting from non-REM stage 1, 2, 3 to first REM period, and they repeat after every 90 minutes. As you can see, the REM sleep tends to get longer towards the later half of the night, but the slow wave sleep is predominantly seen in the first third, first half of the night. Things that happen in non-REM sleep tend to happen in the first half of the night, whereas REM, things that happen in REM sleep, like sleep apnea, gets worse in REM sleep, more so towards the later half of the night. Across our lifespan, our sleep changes. REM sleep decreases by about 25 to about 25% and remains stable for the rest of the life. Slow wave sleep tends to decrease across life. It's almost negligible in older adults. Older men compared to women have less slow wave sleep, and it might have a protective effect for memory. So men lose their mind more when they get older than women. Sleep disorders affect about 20% of general population. Insomnia by far is the most common sleep disorder, followed by sleep apnea, restless leg syndrome, and other sleep disorders. All these sleep disorders cause cognitive impairments. They cause accidents, because work absenteeism reduces quality of life if untreated. Insomnia affects about 40 million Americans. Actually, the cost of treating sleep disorders is less than cost of leaving them untreated. What is insomnia? People with insomnia, they have difficulty initiating, maintaining sleep, or they don't feel rested. Its pervasive effect, happens at least 3 nights a week for 3 months at least. They can't sleep despite having the opportunity to sleep. They're not sleep deprived. And we are to see that they don't have other sleep disorders. And they're not this is not the effect of the substance like excessive caffeine or any other drug abuse. When we talk about insomnia, we talk about two processes, process H, homeostatic process, and the process C, a circadian process. The more we are awake, the more sleepy we get. That is a homeostatic process. Circadian process, on the other hand, is we sleep at night, we're awake during the day, our body and mind works like that. These two processes coincide with each other, and that is how a normal sleep cycle forms. What might be some of the causes and risk factors for insomnia? Insomnia can be an insomnia disorder. People have a hard time initiating sleep. Sort of, to put it simply, people have a hard time shutting down their brain at nighttime. It can be due to medical problems like chronic pain, breathing problems. It might be a symptom of a psychiatric problem like depression, anxiety. It might be due to other sleep disorders. It might be related to medications, drug abuse. There might be environmental factors that are not giving chance to have good night's sleep. Insomnia tends to be more in older age related to other medical problems, limited mobility, exercise, lack of exercise that can cause insomnia. Impact of insomnia. Insomnia can reduce quality of life. People who are absent at work are more likely to have insomnia. Insomnia tends to increase accidents. Medical errors are more common in people who have sleep problems. That's why there is a lot of emphasis on resident sleep, trainee sleep. As clinicians, I would advise that we should also pay attention to our sleep. There are higher healthcare costs, cognitive impairments in people who have insomnia. Insomnia can cause or worsen psychiatric problems and medical problems. Actually, chronic pain and other disorders are more common. Pain is worse in people who have insomnia. How do we treat it? Cognitive behavioral therapy for insomnia is the treatment. Medications can help for short-term. Usually, we recommend for short-term use of insomnia. Other treatments like exercise, relaxation, and things like that can help. Cognitive behavioral therapy of insomnia is the gold standard treatment for insomnia. What it is actually a sleep-specific therapy, consists of 5-6 sessions that focus on sleep, hygiene, sleep schedule, looking at some of the cognitive distortions that might be affecting sleep. And we, as human beings, were conditioned to sleeping well and sleeping not well, and sort of deconditioning that process. Not everybody knows cognitive behavioral therapy. Insomnia is not easily available. So then there is digital CBTI, which is coming up and will be hopefully available as a prescription. There are sleep therapy programs that incorporate various sleep CBTI elements, and a lot of them. Sleep apnea. Dr. Anur Batul is going to give you an overview about sleep disorders. I'm going to, for the sake of time, skip this, except that diets rich in iron for restless leg syndrome, in which you have uneasy discomfort in legs at nighttime or in the evening and nighttime. Things like diets rich in iron supplements, good night's sleep can help, and medications that may cause it to worsen that need to be avoided. What about sleep and psychiatric disorders? Insomnia can be a common symptom. It actually is a presenting symptom in a lot of psychiatric disorders, particularly depression. 2/3 of depressed patients present with insomnia, and those who don't have hypersomnia and they sleep more. there is high prevalence of primary sleep disorders like sleep apnea, restless leg syndrome, and other sleep disorders in patients with depression. There is a bidirectional relationship between sleep disorders and psychiatric disorders. Say, for example, insomnia. Patients who have insomnia are more likely to get depressed. Depressed patients are more insomniac. They can present as insomnia. Depressed patients, when they're treated, if they have continued insomnia, they are at increased risk for relapse. So treating sleep problems has a preventive role, a screening for sleep disorders in all patients, particularly psychiatric patients presenting with psychiatric presentations, has an added benefit for overall health. Talking specifically about insomnia is a risk factor for depression. Dr. Khan will tell you as an addiction specialist that insomnia can be a risk factor for substance abuse. Patients with substance abuse, drug abuse, those who recover from substance abuse continue to have sleep problems, and that puts them at increased risk for relapse. Insomnia can be a symptom of depression. There is better outcome with treatment. It can be a sign of a bipolar disorder, psychosis, and it can be lead to depression, bipolar disorder, psychosis, cognitive disorders like dementia and things like that. About sleep apnea and depression, there is also an overlap between depression and sleep apnea. Symptoms can overlap. Sometimes, patients with sleep apnea, untreated sleep apnea can have tiredness and fatigue. They can have depression. Patients with depression may not respond well to treatment if they have untreated sleep apnea. Sleep apnea itself can cause insomnia. It can also cause anxiety, particularly nocturnal anxiety due to decrease in oxygen and things like that. Restless leg syndrome can present as insomnia. It can lead to depression, and there are medications that we use to treat depression and other psychiatric problems can cause restless leg syndrome. Alcohol can cause restless leg syndrome, and it can happen in substance abuse withdrawal, drug withdrawal. Sleep is an indicator of health. Sleep is not a sign of weakness, it's not a strength, it's a biological need. We need it, it is good for health. Sleep has a restorative function. Sleep helps with learning. Sleep increases our productivity. Sleep prevents against medical and psychiatric problems. Both insomnia and sleep apnea, other sleep disorders, have preventive role in preventing medical and psychiatric problems, drug abuse, cognitive problems. People who have cognitive problems, they tend to stay longer in their homes and assisted living facilities if their sleep disorders are treated. Similarly, restless leg syndrome can lead to comorbid psychiatric problems. Now, how can we improve our sleep? We want to pay attention to sleep. We think about, our house, we think about work, we think about our home office. We also want to pay attention to sleep. Could you have an untreated sleep problem? Are you getting adequate sleep? Dr. Anwar Batul will tell you in a minute how much sleep sort of you might need. And what are some of the healthy sleep habits? If you have trouble falling asleep, maintaining it, or you don't feel rested, you don't feel alert during the day when you should be alert, you could have a sleep disorder. If you are snoring at night, somebody is saying that you stop breathing, things like that, unusual things happen in sleep, you could have a sleep disorder. It might be a good idea to talk to your doctor or see a sleep specialist if these things happen. Are you getting adequate sleep? We'll talk about that in a minute. One of the things we can do to improve sleep. Maintain a regular wake up and sleep time even on weekends. Try not to have too much variations. Try to go to bed when sleepy. Bedroom is not, it is a sleep sanctuary. It's not for doing office work. It's not for watching TV. It's not for, worrying about world and solving world problems. Because we get entrained, we get conditioned to a state, we are sophisticated animals, we get conditioned to what we do in relation to our surroundings. If we are, working in our bedroom, then when we go to sleep, our brain knows, come, let's, work, because it gets conditioned that way. If you have insomnia at night, you want to avoid naps during the day. Try to relax in preparation for sleep, exercise regularly, have a regular schedule. Avoid things like caffeine, alcohol, tobacco that can hamper sleep. Caffeine, particularly in the afternoon, is, we want people to avoid it if they have trouble with sleep. Pay attention to sleep. Sleep is important. Avoid sleep disruptors, noises. Some people have pets. Bedroom needs to be comfortable at a comfortable temperature. And earn sleep. The way we get sleepy by being tired physically and mentally. There is a saying actually in Urdu, I'm going to try to translate it. Those who sleep in castles do not necessarily sleep better than those who sleep on rocks. महल में सोने वालों के ख्वाब पत्थर पे सोने वालों के ख्वाब से ज्यादा हसीन नहीं होते. So if we pay attention to sleep, try to relax, observe good sleep habits, it will help. It's all relative. Let's be content with what we have, and let's pray for better health and well-being of everybody. Thank you.
Thank you, Dr. Khurshid. Now we will hand it over to Dr. Batul Anwar.
Hello, thank you so much for arranging this educational webinar. And pretty much whatever Dr. Khurshid has said, I'm going to emphasize more on some of the same things. I do not have any industry or financial interest to disclose here. So as he had already mentioned, that sleep is one of the important pillars of our good health. Just like exercise and healthy diet are important for us, sleep is as important, as since we spent almost 1/3 of our lifetime while sleeping. And the same things that he had already been mentioned, that sleep restores our energy and alertness. It's good for our cardiovascular health. Growth and development occurs during sleep. Immunity is improved when people have good sleep. Learning and memory also are strengthened while sleep. Memory consolidation occurs during the REM sleep. And it's much more important for our children and adolescents to have good night's sleep, because the research has suggested that people who sleep better have better grades and have better learning and memory skills. And also it has a strong relationship with our mood and mental health, and people are volatile if they are sleep deprived. And the same two processes, the homeostatic and the circadian rhythm. So homeostatic processes just explains that the longer we stay awake, the sleepier we get at the end of the day. And the circadian rhythm is 24-hour, maintaining our body clock of awake and sleep periods, and just making sure that we have certain periods of awakeness and then sleep. We do get a midday sleepiness. Everybody gets that around 3-4 o'clock when we reach out for our coffee. And that's a normal circadian rhythm that we all have. And these two processes work together and maintain our wakefulness and sleep. How much sleep is important? People have these myths that I only need 5 hours or 6 hours of sleep, or I'm good after 5 hours of sleep. The research suggests that everybody needs at least 7 hours of sleep. Even as an adult, we need more than 7 hours of sleep. And some people need even 8 or 9 hours of sleep. Our sleep needs do decrease as we age. And we all know that as an infant, we sleep a lot. Pretty much during the day we nap, and during childhood we nap, but then as we age, our sleep requirement goes down. But we need to make sure that we get at least 7 hours of sleep in a 24-hour cycle. Insufficient sleep or sleep deprivation influence our health and also impairs our quality of life. It can lead to sleepiness, our performance is decreased, there's high chance of motor vehicle crashes. And this is a national tragedy. There's so many people are behind the wheel when they are not adequately rested, and they put themselves and others on the road at risk. There's mood disorder and also health risk. This study just demonstrates that after staying awake for more than 24 hours, how the performance goes down. And sleep deprivation also increases the risk for cardiovascular disease. This is a study that from 2003 that showed that people who slept less than 5 hours had higher risk of dying from heart disease, as opposed to people who sleeping less. In this study, they did show that people who slept more than 9 hours were also at risk for dying. It's possible that these people had other comorbid conditions, but definitely sleeping less than 7 hours is not good for our cardiovascular health. And sleep deprivation takes years off of our life. And there's epidemiological studies suggesting that mortality increases with sleep deprivation. Sleep and heart health. When we are sleeping, our heart rate and blood pressure dips during sleep, which is a normal phenomena. And if it doesn't happen, then there's increased chance of developing high blood pressure. There's a higher chance of developing high blood pressure, heart failure, atrial fibrillation, which is a cardiac rhythm abnormality. There's also a marked association with the development of diabetes, and also weight gain is also associated with poor sleep. People who are sleep deprived, their hormone regulation is impaired in such a way that they gain weight if they are sleep deprived. So another reason, if we want to maintain our weight, we need to get adequate amount of sleep, because they're definitely the sleep deprivation affecting hormone, which leads us to gain weight. The most common disorder that we see among sleep clinics is obstructive sleep apnea, which is usually brought to our attention by the bed partners who hear their partners snoring very loudly. And it's basically a disorder of sleep and breathing. There's a collapse at the upper airway level, and people are waking up during the night frequently, with the result that they wake up tired despite spending 7-8 hours in bed. There's increased prevalence of obstructive sleep apnea among middle-aged adults. Up to this day, also, all the studies are from old studies, and most of the sleep apnea patients are still unrecognized. And as you can see that when you, on this slide, that when people with sleep apnea, when they're sleeping, there is tongue is falling back and there's barely any room for the air to go through. So we do not get enough air when we're sleeping, and that causes our brain to wake up. There's a fight and flight response in our body. The brain wakes us up, and then we take a deep breath, open up the airway here, go back to sleep, happens again. It just keeps happening throughout the night. The main symptoms of sleep apnea include loud snoring. Some people often wake up gasping and choking. And usually the history is given by the bed partner, and they are more reliable in providing us with the history. Increased risk of work-related or automobile accidents have been reported. Personality changes and cognitive problems have been also associated. The diagnosis and treatment of sleep apnea. Back in a few years ago, we only used to do the sleep studies in the sleep lab, but now we have the ability to do home sleep testing. So people need to be evaluated in the clinic, and then we do either, depending on their symptoms and need, we either order a sleep study in the hospital or home-based study, which are very simple. They can be done in our house. The treatment, again, sometimes just behavioral modification, including weight loss or sleeping on a side, can just treat the sleep apnea. Then positive airway pressure treatment, or the Cpap treatment, is the gold standard for treating sleep apnea. Then there's a dental appliance also help with the sleep apnea, and upper airway surgery is another alternative. And nowadays there's a new treatment called Inspire, or the hypoglossal nerve stimulation, which is also being used among patients for sleep apnea. Insomnia has already been discussed, that it increases with age, more common among women, has bidirectional relationship with depression and comorbid medical conditions. Also, there's an increased risk of cardiovascular risk factors. Insomnia was more common, and also shorter sleep duration. Among 40% of the insomniac reported at least one chronic painful physical condition. So these are the studies from 1999 and 2005 that reported the association of insomnia with medical and psychiatric illnesses. Behavioral treatment is the gold standard for treating insomnia. As a first step, we try to avoid using medications. The first thing we tell our patients to just make sure to keep a consistent sleeping pattern, have a consistent sleeping pattern without having too many variations, whether it's holiday or weekend. Try to maintain a same schedule every single day. The bedroom should be technology-free zone. Unfortunately, our children and most of us have television in the bedroom or telephone on our bedside. So these are the things, these are all stimulants, and then we should be avoiding these things when we are trying to sleep. It should have a relaxing bedtime routine, and definitely avoiding daytime naps. Alcohol and caffeine can also affect sleep. Caffeine sometimes can stay in the system up to 7-8 hours. So it should be avoided 7-8 hours prior to bedtime. And alcohol, it can cause sedation, but it fragments the sleep, so and also deprives you of REM sleep. So it's not a good thing to have alcohol at bedtime. Also, regular exercise is good for a good sleep. Exercise is a stimulating activity, so it should be avoided close to bedtime. So it's better to do exercise either in the morning or early afternoon. And one thing that we tell our patient, not to have a clock watching while they're trying to sleep, because that generates another anxiety and they cannot fall asleep again. The pharmacotherapy, we can use different medications. Not going to go in much detail about this. The restless leg syndrome is another sleep disorder, which is characterized by irresistible urge to move their legs. It's more common among women, and it gets worse during pregnancy, or if they have any kidney problems or iron deficiency, the restless leg is worse. There is an association between restless leg syndrome and cardiovascular disease. So the first thing that we need to do is to recognize the importance of our sleep. We need to educate ourselves and our children about sleep and learn to recognize the sign of inadequate sleep. There's increase in the number of children being diagnosed with attention deficit disorder. And most of them don't even have evaluation from the sleep specialist, because these kids are not getting enough sleep. They all have they are wired to this technology, and they do not get enough sleep. Their evening activities, sport activities, the social life also pushes their bedtimes too late, which is also not good for them. We need to provide a sleep-friendly home environment, and we enforce appropriate sleep schedules. We need to set limits on our after-school activities and our jobs as much as we can. And that will help us safe on the road. And also, if anybody who's sleep deprived should not be sitting behind the wheel. They just make sure that if we are sleepy, we have somebody else drive the car and not drive ourselves. We need to be a good sleep role model to pass it on to our children and to our community and promote a good sleep habit. Thank you.
Thank you, Dr. Patul. Interesting presentation. So it's open for questions. So I have a question from Mr. Muhammad Naweed. He's saying 7+ hours of night sleep gradually becomes like a holy grail and good old memory. How much a minimum hour of continuous night sleep one should try to have? And he has a second question. Does spreading 7 hours in a day helps? So I guess like he's trying to suggest like anyone can take it. It's open for, either Dr. Badul wants to take it or Dr. Rashid.
So we do not recommend sleeping less than 7 hours, or at least not less than 6 hours. It should be more than 6, and not splitting it into two different portions of sleep is as good as the same one consolidated sleep. So if we avoid the daytime naps, we can have a good night's sleep at nighttime.
So the other question is from Yusuf. How daylight saving time affects sleep? So I guess Dr. Khurshid can take it if he wants to.
Sure. I would say, it is like, it can be disruptive for sleep, particularly for children. And there was a move towards kind of providing some recommendations about that. And instead of doing it on Sunday, it could be done on Friday. So, and in preparation for it, people can get prepared kind of 2-3 days in advance, try to advance their sleep time, or kind of postpone it depending on what way you're going. So say the question again.
So how daylight saving time affect sleep?
I would say it's we do get used to changes and takes few days. So if we get prepared towards it, then we can deal with it better. So days do tend to get shorter in winter and longer summertime. So there is, unless we use other things, like if we have daylight when it is evening sleep time, we tend to sunlight tends to postpone our sleep initiation, and so it does affect sleep. I think the question is, how do we better deal with it? So in that sense, I would say we should be prepared to deal with it and start a few days in advance to deal with it better.
So Saud has a question. He's asking, what are the alarming features regarding insomnia that someone needs to seek doctor advice before trying anything over the counter meds like melatonin or Benadryl. So anyone can take it.
Yeah, I would say, if every now and then you can have a sleepless night under stress, in preparation for something. But if it is happening frequently, it's like a daily thing. It happens multiple times a week. It has been happening for months. It is affecting your productivity. It is impairing you. I think, you need to seek help. And over-the-counter medications might not be the best, although, I do advise melatonin at times. Not for everybody. So I would say if is a disorder, if it's a problem in itself, I would advise that you see a sleep specialist.
So Tahir Ali has a question. Why does RLS, restless leg, relates to depression? How is that related at all? So
It seems like it's a medical question then, it's, so I would say, yeah, there is increased prevalence of restless leg syndrome in patients with depression. RLS patients are at increased risk for depression. There is, there is a biological hypothesis and there is a medication overlap. Some of the medications can cause RLS, some of the antidepressant medication can cause restless leg syndrome or can make it worse. Now, the biological explanation is that restless leg syndrome is actually considered to be due to dopamine deficiency. Iron is needed in formation of dopamine. So if you have less of dopamine, you are at increased risk for depression. So that is, was that the question? What is the reason?
the question was, why does RLS relates to depression? How does that is related? So I think the question is like why they are saying restless is related to depression, since it is more like a medical illness, and the other one is like a psychiatric illness. So I think that's the question.
Let me clarify. Depression is a biological illness. Even if it is induced by stress, can be caused by stress. There are people who don't have any stress and can get depressed, who have family history of depression. So with depression, in that sense, is a medical problem. So, and there is a biological explanation for why RLS patients might be at high risk for depression. And the medications can cause it, that somebody might be taking for depression can cause restless leg syndrome.
And also the fact that the RLS patients have such fragmented sleep, so they do not get enough sleep.
Exactly.
And like you mentioned earlier, that there is a bidirectional relationship between the mental health and the sleep. So if you're not sleeping well, maybe you develop the depression afterwards because you haven't had a restful sleep.
Exactly.
So there is another question. This one I will give it to Dr. Abdul, or if she wants to take it. Saud is asking, what is the best time to take melatonin in case we have to take it? Like 2 hours before your usual sleep time versus 2 hours of trying to sleep and unable to get any sleep.
So melatonin is hormone of the dark hormone, or it's secreted at nighttime. And usually we recommend sleeping a couple of hours before bedtime to taking the melatonin is the ideal time because it maintains the secretion of melatonin, timed secretion of melatonin.
So 2 hours before, or?
Yeah.
That would be okay.
2-3 hours before bedtime. And another important thing is we need to make sure that we dim the lights in the evening. We do not need to have bright lights in the house all the time. But a couple of hours before bedtime, we need to dim the light. So that helps secretes the melatonin as well. So we need to dim the light, take the melatonin, and then try to go to sleep.
There is another one from Muhammad Naweed. With shorter summer nights, does body need lesser night sleep? Even birds begin creeping at 4 in the morning. Doesn't body need sleep needs varies with time of the year? Anyone
And
can.
as I had said, that we do need at least 6-7 hours of sleep. Nothing less than 7 is adequate for good health. So we need to make sure that we get adequate amount of sleep. I know there's a myth that people can live with this shorter amount of sleep, but that's not the truth.
So I have a question, like for Dr. Batul actually, and then for Dr. Khurshid as well. You mentioned like your interest was also in sleep disorders in ICU. So how is sleep affected in ICU as compared to a person who is, doing activity of daily living and they have sleep disorder? Are those the same or different?
I mean, the patients you're talking about, correct? Or the
Yes.
providers?
So I guess that brings an interesting point.
Yeah, because I mean, it affects our health too. So the nurses work 24, I mean, we are in a 24/7 society and we are sleep deprived society. So and another unfortunate thing is that during the day when people who night shift workers, if they want to sleep during the day, it's not the same thing for them. The world is not sleeping. There's going to be noise outside and you need to make sure that you have the eye cover and the ear noise machine, something to block the noise from the environment so you can just create a nighttime type of environment so you can get sleep. In the ICU, definitely, I mean, we try to minimize the noise in the hospital nowadays. At every unit, we have this noise control, but again, it's unfortunate. There are alarms and there are and people in the ICU, if they are on sedation, so their sleep is definitely their rhythm is completely off when they leave the ICU.
So the other question I have for Dr. Khurshid is like, is there like any short-term sleep disorders and then chronic sleep disorders? Are those the different or they are different and can they manage differently?
You can have insomnia under stress. So a lot of like acute stress disorders, you can have insomnia as a symptom, they tend to resolve. By far, if it continues for weeks and months, it tends to, that's one of the ways insomnia develops, is that it continues for longer periods of time and we get used to that dysfunctional insomniac state. That's why I was telling earlier, we get conditioned, and if we're in bedroom and we have trouble sleeping, our brain gets used to, oh my God, I'm going to go into my bed and now I'm going to deal with another sleepless night. So we get conditioned that way. The longer they last, they can become chronic.
So there's a question. He's again, I think he's asking, is there any catching up of lost sleep? If you have been sleeping only 4 to 5 hours during the week, can you catch up by sleeping more over the weekend? Anyone can take it, I guess.
So, I mean, it's not a bank debt that you can pay back over the weekend. So it's ideal to keep a consistency in the sleeping pattern, but 4 or 5 hours is definitely not good for overall health.
So can you catch up or you still need
so one bad night is not equal to one good night. So you need to have more sleep to make up for that one night, but that should not be, I mean, you miss it one night, that's fine, but that should not be a routine.
Nice. So question for Dr. Khurshid, again from me, is adolescent, adults, and individuals more than 65 years of age, if they are having a sleep disorders, although the first line treatment, as you mentioned, like is CBT, sleep hygiene, but do you feel like there might be some different treatment modalities that you try to use for adolescents, adults, and individuals more than 65 that works better in that age range?
You want me to take it?
Yes, please.
Yeah. So, good thing about children is that they tend to respond faster. So it might be hard to impose some of the digital curfew and other things, but children tend to also get used to changes. They adapt faster. And few other things is that, come advent of adolescence, there tends to be a tendency towards delayed sleep. So they go to bed late and they wake up late, and that can affect their learning. When they wake up, they are sleepy, and in school they might struggle with learning. So adjusting for those things, if there is delayed sleep, is having them exposure to bright light in the morning or more light during the day might be the way to go about adolescent delayed sleep, which is a common thing happens in adolescents and teens. In elderly folks, the sleep cycle tends to get haphazard, tends to mix up. Happens more with neurological disorders like Parkinson's disease and other. It doesn't seem to have the consolidated quality anymore. They tend to have more naps. They also tend to have more advanced sleep phase. They feel sleepy earlier. So there is role of bright light during the day and in the evening under those circumstances, compared to teens and adolescents, where you would have the bright light first thing in the morning during the day, while as elderly folks and patients in nursing homes or those with cognitive disorders, having exposure to bright light and exercise has a good effect on sleep as well as their cognition as well as delirium.
Thank you. So there's a question from Yusuf Sheikh. I will hand it to Dr. Batul. She's asking, does sleep apnea condition happens regularly, or it is an occasional thing? And what can be fine before taking any medical treatment?
So as I said, the sleep apnea is a very common and unrecognized problem. It's mainly a disease of male gender, but among women, it happens around menopause. It becomes the same prevalence. Also, with weight gain, sleep apnea tends to get worse. So maintaining a good lifestyle, behavioral modification may help control some degree of sleep apnea. Sleep apnea is definitely has association with heart disease, stroke, diabetes, so something that should never be ignored. And if a person is snoring and has a daytime fatigue and sleepiness, it's good to have it checked out rather than just ignoring it.
So what you're suggesting, regardless if it is a short term, it still needs to be evaluated by a medical professional. That should not be taken lightly.
Yeah.
Dr. Khurshid, the next one I will give it to you because you have been talking about that time thing quite a bit. So Zakir Ali is asking, as a Muslim, we want to get up the Tahajjud, Fajr, and then sleep again, and that breaks the cycle of sleep into two. Will that impact health? Another question, any side effects of Cpap machine for longer periods of time? So you can refer it to Dr. Batul or you can answer it.
Yeah, I would say, in general, we want regular sleep schedule. We want more consolidated sleep. But, it is also very important. We want to be content and, feel good about what we're doing and, in our faith, and we want to be satisfied with our life, and so that has a protective effect. So having like that sort of broken sleep but then consolidated after that, I don't think of any studies, but I don't think it should have a big overall negative impact as long as you're getting good sleep. And what was the second question?
So he's saying, will that impact health? And other question is, any side effects of Cpap machine for a longer period of time if someone is using it?
In general, Cpap is tolerated well. If you tolerate it well, most patients do, about half. And, there can be some minor side effects related to, say, Dr. Arnold Batul will tell you more about it, maybe high pressures. You can have some side effects, and sometimes, people may have sense of bloating and things like that. But in general, they're not any significant long-term side effects. I will let Dr. Arnold Batul, say more about it.
No, you're right. They're pretty much very well tolerated. And besides these discomfort or a nuisance for the patient to have the mask on their face, there are no medical negative effects of using the CPAP. As long as if there is no major lung problem, because if someone has emphysema or they have big blebs in their lungs, and or they have the chance of rupturing could be there, but usually we have not seen it in our common practice.
So Saud is asking a question, are there any studies which suggest that power nap in the afternoon makes you more productive during the day? As seems like you are discouraging for having daytime naps. A power nap, does it help?
If they're scheduled and if they're in the early part of the day, the short period scheduled, but it should not go more than an hour, or it should not be late in the evening, so it shouldn't impact the nighttime sleep. Definitely the siesta or the napping has benefits, but if it becomes late in the day, then it affects the nighttime sleep.
Yeah, to add to it, I would say, in general, if you have trouble sleeping at night, so you might want to avoid naps during the day. But there are patients who are sleepy, who have sleep disorders like narcolepsy, whereas, short naps would be helpful.
Dr. Batul, this one I will give it to you. For someone prescribed to use CPAP, this is from Mr. Sajid Hussain, what is the success rate if they started using a dental device instead?
So that depends on the severity of sleep apnea. So if it's moderate or severe sleep apnea, it's not, the dental device only, I think, 50-60% successful in controlling the sleep apnea symptoms, whereas CPAP is 100% helpful in treating the sleep apnea symptoms. But if it's very mild, then dental appliance, it could very well control the symptoms.
So far, that's it. Any other questions, concerns? We are almost on time.
So Mr. Tahirli is saying that I knew a loose tongue can get one in trouble. Somebody speaking, but then he says, didn't realize that causes the snoring as well. But I think because he
because I showed the
sketch,
picture.
tongue is yeah. So how do you control the loose tongue? I have a question about the impact of COVID on the sleep. Has there been any knowledge that those people who got the COVID had problem sleep also?
Yes, definitely. There is increased in the quality of poor quality of sleep among people affected by COVID. There've been papers suggesting that increase in the insomnia after COVID. And also people have complained of excessive daytime sleepiness during the daytime, or fatigue. And also some studies have suggested sleep apnea, because if they had severe COVID and they were in the ICU, then maybe it's just the airway, they were on the mechanical ventilation. And if that inflammation has made it worse, now that it's presenting with obstructive sleep apnea. So pretty much most of the sleep disorders are being presented after this. And there's a big consortium in Boston going on right now that they're trying to look into the post COVID sequela of sleep particularly.
Very good. If anybody has more question, we can continue. Otherwise, it's 7:04, exactly 1 hour into our talk.
I think I don't see any.
Thank you.
Thank you.
Thank you very much. Appreciate everybody coming in. And this recording will be available on our YouTube channel. Thank you again, once again. Hopefully, inshallah, we'll see everyone again in the next talk next month. Thank you.
Thank
Thank
you.
you again. Thank
Thank
you.
you.
Thank you.
Thank you.
We appreciate it. Thank you, everyone.
Allah.
Thank you, Tahir Saab.
Okay, Kaisar, thank you very much.
Thank you, Yusuf, for